Hello, I'm Stacy Jones with Sanford Health. In this edition of Under the Blue Lights, we're talking with Mike Begeman, Sanford Health's Vice President of Public Affairs. Mike, thanks for joining us.
It's a pleasure to be here, Stacy.
Well, Mike, why don't you tell us a little bit about what your department does, what happens in public affairs?
Be glad to. Well, this department was started about 7 years ago under the direction of Ray Trankel, and kind of our whole focus was to deal with the external stakeholders of our organization, and that's kind of what our focus is as we speak today. Since Ray has been here and now has kind of semi-retired, we have added some additional members to our team. Stacy Thompson started about a year ago and works in the area of women's and children's. Rod Carlson also works in the area of community development and public affairs, and of course Ann Degg, our assistant, is also part of that team as well. And we basically are involved in a lot of areas of the community, and as I mentioned, the external stakeholder piece is very important. We try to connect with those external stakeholders, and we try to educate, clarify, and just keep people updated on a general basis as to what's going on with Sanford Health, not only in our community, but in our region and also even around the country.
How do you go about doing that, and what information do you get with the people that you meet?
There's a couple of different things that we try to do. Number one, we try to formulate a group of who our stakeholders are. And so between the members of my team, me for example, my focus has been and will continue to be in our region. So in our communities, in our rural healthcare communities, those are the people that I connect with. So through service clubs, for example, and leadership luncheons with folks in the community, that might be the city council, it might be chamber directors, it might be the mayor, the chamber boards, and anybody else that would have an interest in being part of those connecting pieces. And so it keeps us pretty busy. As you know, there's about 80,000 square miles in our region, and we cover those extensively, and we meet on a quarterly basis with a group that I know are called a consumer council group. And those would be a sitting group of folks that we recruit to kind of be a cross-section of the community. They could be superintendents of the schools, they might be the chamber director again, they may be a retiree. We try to have a really nice cross-section of people that we can meet with on a quarterly basis. And in addition to those groups, we have folks that we like to also bring together in leadership luncheons or community luncheons that we, again, update, clarify, educate on things that are going on in healthcare and specifically with Sanford Health.
And I would imagine that we get a lot of nice feedback from these people too.
We really do. And one of the things that I think is important to note is that we really are looking to gain that feedback, whether that be positive or sometimes negative. That feedback enables us to get better and to do a better job of taking care of the people that we have in those rural communities. As you know, we have many things going on at Sanford Health with the Sanford initiatives and the research and development and a lot of things that happen on a daily basis. But we want to make sure people know that we still, the core business of Sanford Health is to take care of patients and make people well. And many times people don't really think about health care unless they really have to use it. And making sure that health care is delivered as close to their home as possible is the focus of our Sanford Health Network and Ed Whelan and his team. But it's also the focus that we try to communicate that message in that rural community as well.
In addition to meeting with some of these community leaders and some of the stakeholders, I know that your department also kind of gives back and contributes to some of these communities. Why don't you talk about that and what the Public Affairs Department has done?
Sure. About 10 years ago, obviously, when Kelby came on board, he kind of established the idea that our organization needs to give back to the community. And that community dividend fund is kind of what transitioned out of those discussions. And that community dividend fund is dollars that we try to balance in terms of investing in our community of the Sioux Falls area, but also in the region. And those dollars are distributed in 3 basic areas, and they are education, healthcare obviously, and then also it can also include economic development. So there's a pretty wide range of areas that would fit into those 3 criteria. And Kelby really felt that it is important for our organization to give back to the communities. And those may end up in areas maybe in education, for example, doing something for the school, the local school, in the areas of maybe assisting in a fundraiser to buy a piece of equipment. It may be assisting a fundraiser in the local YMCA. It may be assisting in something to do with the hospital. And I really try to work closely with the local administrator to partner with them, because these are really all partnerships. It's not just dollars that we just decide arbitrarily to spend. These are dollars that we try to partner with our local communities and with that local entity, whether that be the hospital or the clinic, to try to make sure that there's an opportunity to help that community prosper and to make that quality of life a little bit better for those folks that live in the community.
Why is it so important for Sanford Health to give back to these communities?
Well, and that's a great question, and that's something that is very dear to Kelby's heart and all of our leadership team. But the fact that we are a successful organization, and as Denny likes to say, being successful also means we now have to be significant. And I think that's really a true test of what our culture has been, and we've kind of stayed with that idea that people living in not only in the Sioux Falls community, but in the communities that we serve in the region, the quality of life is very important. And we feel as a health system that it's important that we are able to give back and to assist those communities so that the schools are strong and the healthcare, whether that be a hospital or a clinic, making sure that they have the right materials and they have the right equipment, and that community is strong, and therefore those people have an opportunity to live a very quality style of life.
Personally, what's it like for you to be able to be a part of this, to go into these communities and talk to people, as well as be someone who helps, you know, give back what Sanford does?
You know, Stacy, it's very rewarding, and sometimes I feel a bit guilty because I'm the one that gets to be out in the community and hear about the warm and fuzzies, things that people like to comment on. For example, how they're taken care of in one of our facilities. If a loved one, for example, has been sick, as you know, we've already talked a little bit about the fact that people really don't think about health care until they have to use it. And it's so refreshing to kind of hear some of those really nice stories about, you know, people getting well and people being able to get well close to home. And so those are some really neat things. I get many thank yous from organizations and groups that maybe are participating with us in one of those community dividend fund partnerships. Things like Driver's Edge or those types of programs that help kids. Many of our programs involve kids and education, as you can probably understand. It's easy to have a good feeling about helping kids and helping communities prosper. So just a lot of things that I think our organization as Sanford Health and our focus on making people well allows us to do some really neat things, and maybe sometimes things that people don't really hear about, but yet they're things that are very important in the communities that we serve.
Well, thank you, Mike, for joining us on this edition of Under the Blue Lights. Please visit us again at sanfordhealth.org for more updates.